this medication is solving a problem by just masking the symptom. It's not actually solving the problem underneath it. The studies have shown that over 95% of women with postpartum depression, anxiety, psychosis have a copper toxicity. I'm Dr. Aimie, your guide for transforming your trauma into your gift. You adapted to life experiences to survive, but you are not your trauma. An article just got released August 4, 2023, that you might think is a great thing. This is good news. And I would have thought so too, if I did not know the root cause of postpartum depression. So the FDA approves its first pill for postpartum depression. And this is a big thing because there has not been anything specific for postpartum depression. So this is the first oral medication that is specific for postpartum depression. Now, what is the problem here? The problem is that this medication called Zuranolone is a neuroactive steroid that acts on the GABA receptors. And GABA receptors are receiving the GABA neurotransmitter, which is your neurotransmitter for calming your nervous system. We can talk about the nervous system being activated, whether that's high energy or irritability, but this activation, and GABA is the one that calms it down. This is a wonderful supplement. GABA is a wonderful supplement that can help many people with sleep, can help people with reducing their muscle bracing patterns and tension because it relaxes the nervous system. But is GABA the reason for postpartum depression? And the answer is no. And so this medication is solving a problem by just masking the symptom. It's not actually solving the problem underneath it. So what is the problem? The studies have shown, and this is largely coming out of the Walsh Research Institute, is that over 95% of women with postpartum depression, anxiety, psychosis, whatever that postpartum mood sequelae are, over 95% of them have a copper toxicity. This means that they have a copper excess. There's different ways that you can have a copper excess. You can have a zinc deficiency. Zinc deficiency is one of the most common deficiencies in those with mood and mental health struggles. So isn't that interesting? And so you can have the copper excess from a zinc deficiency, or you can just have a copper excess because you have too much copper. Now, how we test this is that we look at the copper to zinc ratio. And we also need to look at how much free copper is in the blood, because it normally travels through the blood bound to a protein. That protein is called ceruloplasmin. And so you have, what you're looking for is that free copper. Is that free copper in so much excess that it is causing irritability and activation of the nervous system? Copper toxicity is it's a toxin for the nervous system. It's an irritant. And so people who have copper excess, there are some very predictable traits that they have. One of which is just they are super irritable, very easy to get angry, very easy to snap. And one minute they can be fine, and then the next minute they are so angry. But then you can also have these other aspects of the copper excess where it's more depression and fatigue and fibromyalgia and just body aches. So actually what I would love to share with you is a sheet that I use in my biology of trauma health coaching, a sheet that I use to assess for if people might have this copper toxicity. Now, this is something that on this sheet that I'll give you, it doesn't just look for the copper toxicity. It also looks at the two other most common biochemical imbalances that I see in those whose body has gone into a chronic functional freeze, or their body is living in a chronic trauma response, a trauma physiology. And this is so many people. This might be you as well. But what I'd like to share with you is just this assessment form so that you can look through those traits. And if you have several of the traits on this sheet, you may want to get tested. And I have my biology of trauma health coaches that are able to look through that assessment with you, guide you in terms of testing, and then what to do with those results. But this is huge. And coming back to the postpartum depression, my hope, my ideal would be to actually test someone before they get pregnant. And if this is you and you look through this assessment form and that you have some traits, some personality traits that suggest that you have one of these biochemical imbalances, definitely the copper excess, but any one of these biochemical imbalances, I would so want you to see someone. And again, I have my health coaches if that would serve you, but see someone before you get pregnant so you can balance these biochemical imbalances that will affect your pregnancy, will drain your body more because your body's going to be giving all of its nutrients and life to this growing baby. And so it will deplete you more, leaving you more at risk afterwards for having the fatigue or having mood challenges that you're not able to just bounce back from. And if you are someone or know someone who has been struggling with postpartum depression, postpartum anxiety, this is serious stuff. And this affects a lot of women. The studies say 1 in 7 women. I think that this is actually more from what I've seen. And so knowing that this has a reason and that we don't just need to take a medication that will mask the symptoms of it, but leave that huge problem that will show up in other places in our health, in our life, in our relationships. And so we want to actually address the root problem. And knowing that this copper excess is causing more than 95% of postpartum depression, postpartum anxiety, it seems like such a natural, easy first step to just get tested. Get those copper levels tested. And again, you're going to want to test the copper to zinc ratio and also the ceruloplasmin with the copper. You should also get the liver enzymes with that, especially if you're an adult. If I'm testing children with mood challenges, I don't usually test the liver panel because they're children. They're fine. They haven't beat up their liver. But by the time we're adult, that would be a good idea to do as well. So get tested. Don't just live with this. Don't try to push your way through, power your way through. This is serious. And there is so much better for you. There is so much better for those women who experience postpartum depression and anxiety. And so while I'm thankful that there is more attention on the problem of postpartum depression, the solution is not just masking it. The solution is actually getting tested for these biochemical imbalances that are causing these problems so that we can deal with the root cause. And actually so much more, not just the postpartum depression and anxiety, but so much more will be solved and helped when we balance these biochemical imbalances that we find in our body. So with that, again, I'm Dr. Aimie, founder of Biology of Trauma, and you can find us at traumahealingaccelerated.com, where you can both find a Biology of Trauma professional as well as find a Biology of Trauma health coaching session if you are ready to get your copper levels tested or testing your biochemical imbalances. Check out that assessment form because it will shed a lot of light on whether you might be facing and dealing with and trying to live with a biochemical imbalance unnecessarily.